This patient was taken back to the operating room for an emergency exploratory laparotomy. Once the abdomen was opened, small bowel ischemia was confirmed. The surgeon chose to use the SPY imaging system to assess the full extent of the ischemia. As the image was being captured, the surgeon ran the bowel and marked all areas of ischemia. It was noted that ischemic areas were intermittent rather than continuous, but very easily identified. The surgeon decided to take a large section of small bowel so that only one anastomosis would be required. After the ischemic portion of small bowel was resected, the surgeon took one more SPY image. As the image was being captured, the surgeon again ran the small bowel. No other areas of ischemia were noted, so she proceeded with the small bowel anastomosis. The patient recovered without further complications and was discharged from the hospital. With SPY, the surgeon was quickly able to visualize between ischemic and viable bowel, the operating room time was reduced, and the surgeon felt confident when the patient left the operating room. This young woman, who ingested lye and basically liquefied her esophagus and stomach, had an esophageal reconstruction done 1 year after her injury. SPY imaging during this procedure indicated only half of the colon that was to be used as the graft was being well perfused. Note on the side where there is fluorescence, there is a small artery that is pulsating on the posterior side of the colon. However, the second artery and vein were injured. Because SPY showed exactly where the injury occurred, the plastic and reconstructive team were able to use the internal mammary artery and vein to supercharge the graft and save it. Although there is no post-image, the surgeon confirmed that the anastomosis had healed very well and there was no leak. This is a retrospective SPY-Q analysis that shows a definite line of demarcation where perfusion stops. Note the area of pulsating artery on the lateral posterior side of the colon. Also, the dark vessel close to the demarcation was a vein that was injured with the second artery. In both these cases, SPY demonstrated it is easy to use, gives useful objective data quickly, and helps in making best clinical decisions while the patient is still in the operating room.